The member from Calgary-Elbow.
Thank you very much, Mr. Speaker. It is always an honour to rise in this House and speak to any legislation. But speaking to an important piece of legislation such as Bill 30, which really speaks to the heart of one of the issues that is most important to our province and our communities, and something I hear a lot about in my constituency office and in my travels and talking with Albertans, both my constituents in Calgary-Elbow and beyond, and that is mental health. I just want to start with picking up on some of the comments made by the member for Calgary-Acadia, and I just want to express my disappointment at the opportunity that she took to take partisan shots at Alberta Party leader and former Health Minister Stephen Mandel. And what is so disappointing is that this is a piece of legislation that I think very likely we will support on this side of the House, and I just think that it really does a disservice both to the importance of the topic of this legislation, but also just to the overall tone and tenor of debate in this Assembly when we see unnecessary partisan shots lobbed across the aisle here, and I just, it's not like that particular member. I don't know whether this is some grand strategy kind of cooked up behind the scenes, and then she's part of that, or if that's something that she genuinely, takes to heart. But it frankly doesn't help, and I don't think it actually looks all that good for the government to be doing that. We seem to see that tactic being adopted increasingly as shots at the Alberta Party itself, and I can only conclude, Mr. Speaker, that they obviously see the Alberta Party as a threat in the next election. So here we are. But having said that, I think that the legislation itself, I think, is positive, and perhaps I'll start with a case specifically in my own constituency, dating back about a year or so, when an individual who had absolutely no training whatsoever in addiction treatment or counselling had proposed to turn his 25-foot wide infill house, which was located immediately across the street from an elementary school, into what he called a, quote, addiction treatment facility. And as we went through that process, we discovered at the time that there was absolutely no provincial rule that prevented that from happening. There were some zoning concerns with the city, but the project was initially approved by the City of Calgary's planning department, and they had Alberta Health had absolutely no say about this. Now, I want to hasten to add and make sure I emphasize the fact that addiction treatment facilities, a diverse and broad range of those facilities, both public facilities and private facilities, and not-for-profit facilities and faith-based facilities, all of these have a place in Alberta's landscape for addressing mental health and especially addictions issues. So I want to be very clear that as the MLA for Calgary-Elbow, am very proud to be home to a number of addiction treatment facilities, and they operate very professionally. They operate very ethically. They genuinely help people, and many of those facilities, the ones in Calgary-Elbow in particular, are residential treatment facilities embedded within neighbourhoods within the communities that make up Calgary-Elbow. And I'm absolutely honoured to have those facilities within the boundaries of my constituency, as I know many of my colleagues are with the facilities that exist in their communities. However, there have to be some rules that guide who can call themselves a counselling therapist and who may open a residential or an addiction treatment facility of any kind. This is something I've advocated to the government for some time, and I'm very pleased to see that most of what I have advocated for has come to fruition in this legislation. That's a very positive thing, and so I'm glad to see that. I have to say that some of the questions I hope to hear answers to from the government side through the course of this debate would revolve around the process. One of the challenges that I've heard about from some folks who've been in touch with me are some of the challenges that happened when the College of Social Work was founded, and when there was an expectation that social workers would be licensed. Now, I have to say that beyond a fairly high-level summary that I've received, I actually don't know all of the details of what happened there. But I wanted to just put on the record that some folks have expressed some concerns to me that process was not particularly well handled from the perspective of the person that raised this issue to me. And in particular, it really added to, it created some confusion, I understand, and also added to the cost burden for in particular, contracted service providers. And I haven't yet to have an opportunity to talk with the contracted service providers of their perspective on this bill. I endeavour to do that coming up here tomorrow as I head back to my constituency, and as we prepare for debate on the further stages of this bill later or into next week. And I would hope the government could answer some of those questions proactively for us in terms of, have you talked with those service providers? What will the implications be on them for meeting these standards? Will we see, because although there's a timeline here of November 1st, that's actually a relatively short time frame for these organizations to get ready for accreditation, and also the people who work as service providers within those organizations to themselves become accredited or licensed and recognized. Now, that may frankly be a concern or solving a problem that doesn't exist, because I have to say I don't have the full landscape of exactly how this fits together in existing facilities, but it is a question I wanted to put on the record. I hope the government can answer for us, because I think it's an important one, because I do understand that the social work profession, when that happened, that there were some challenges there, and it's to this day perhaps created some challenges. But without question, the basic principles of the bill, I'm very supportive of. You know, one of the questions that I had initially was whether either faith-based programs or counseling or sort of group programs like AA or Gamblers Anonymous, those sorts of things, whether they would be subject to new regulations or restrictions or constrained in any way. And I'm glad to see, in my understanding from the information we've been provided by the Minister, that in fact is not the case, that those facilities will be outside this legislation and allowed to continue on as they do. And I was also not surprised to see that there are a number of private facilities that are not regulated. The vast majority of those facilities, I understand, are highly professional in their work. Many of them, I understand, are accredited through Accreditation Canada or a similar accreditation body, which has a very high standard of accreditation. And what I would hope is, as the ministry goes forward with the licensing for those facilities, that they would perhaps look at an equivalence of if a facility is currently accredited under Accreditation Canada or a similar very high standard accreditation regime, that would essentially allow them to pass the licensing process. Because the concern is that for facilities that have been in business or in operation for a long time, that are providing a very high level of care with very high professional standards, I would hope that the province does not impose a huge burden on them, which will cost, the cost would be high for that, and take money out of what they would otherwise be using to provide care, especially where they've gone through a process of seeking and receiving a high level of accreditation. So that's something I just wanted to put on the radar for the government. And I'm also interested, and a question I have for the province is, how are you going to work with facilities that are on reserve? I know those facilities are federally regulated, often funded, I understand, by Health Canada, and operate to their standards, but the province then would make it optional for them to comply with provincial standards, but work with them to license. I'm just interested in exactly how those that will work. And same thing in terms of, well, and of course off-reserve facilities would follow provincial laws, as I think should happen. The focus of the bill, I understand, is not so much on efficacy of treatment or treatment methods specifically, but on safety for folks seeking treatment, of consent, and an ability to investigate and make sure that that in fact happens. Because I can tell you that in my experience working with friends and family and people that I know who've gone through the tremendous challenge of trying to overcome addiction, that not every there is no one-size-fits-all. Not one process works for everyone. 12-step programs have been proven to be very effective for some people. They're not as effective for other people. And I think that we need some flexibility there to ensure that a variety of treatment methods are allowed, because not everything works in every individual case. The other question, I guess, which I'll close with, Madam Speaker, is, initially there was some conversation about conversion therapy, and that's not included in this bill. So as we move forward with debate, I'd be very interested in hearing from the government on what their rationale is for not including that in this bill. If they plan to bring forward further legislation at some point to address conversion therapy. I understand there's a private member's bill potentially that may be coming from the government side, which would address that. I think, given the lateness of the calendar, perhaps we won't get to that this fall. But that is something that I understand other provinces have addressed, and I see no reason why this province should not also address that. I'd be very interested to see if the government has what their rationale is for not including it with this bill, and love to hear, in fact, if they plan to bring that forward at some point. So with that, Madam Speaker, I will conclude my remarks, and I will move to adjourn debate.
Having heard the motion as proposed by the honourable member for Calgary-Elbow to adjourn debate, all those in favour please say aye. Aye. Opposed please say no. No. And the motion is carried. The Honourable Deputy Government House Leader.
Thank you. As we have the next